workshop. My name's Pahua. I'm going to be facilitating today's workshop. Note that it is being recorded, so you just got a notification that we are recording this workshop. I have my two colleagues who are also here, and they will be helping me with today's workshop. So Amy Brady and Jacqueline Krause, they will be helping moderate the chat box. But before we start, I want to make sure that your name appears correctly on your Zoom screen, and that is going to help us track who attended the workshop. So make sure if your name isn't listed correctly right now, you do that. And then we are going to jump right in with the workshop. Let me share my screen so we can get the presentation up. Great. All right. So as I mentioned, you're all here because you signed up to attend the educational plan workshop for pre-nursing students. What we are going to go over today is we are going to remind you about the prerequisite classes that you need to take in order to be eligible to apply to the nursing program. We'll talk about community college options. We'll talk also about the application periods, the other additional admission requirements such as the TEAS exam and supplemental volunteer experience, and then talking a little bit more about briefly your backup plan and the importance of having a parallel plan. By the end of today, you should have a good background of how to create a step-by-step educational plan, and in order for you to understand when you should be applying, when you should be eligible to apply to the nursing program. Before we get started, I want to make sure that you mute your audio, and that's to help us avoid background noise coming from your end. If you're not familiar with how to do that, just note that at the bottom of your Zoom, you'll see a microphone, and that microphone you want to click and have the red arrow against cross out of it. If you have questions, you want to use the chat box. As I mentioned, I have two colleagues here who are going to help moderate that and answer your questions. Now, if it's a question that can be answered or will be answered in my presentation, just note we will have Q&A at the end, and your question might be addressed as I'm presenting. You do want to make sure that instead of sending the chat to a particular person, you want to make sure you're sending the chat to everyone. As the presenter, I don't see any of the chat, so I won't be able to address that. So make sure when you're sending your question, it's being sent to everyone. All right, so one of the big tools that you will be using in order to create your step-by-step educational plan is your degree progress report. And this is just to remind you about how to access it. It's under your, it's in your student center under your other drop-down box. This is the degree progress report, the DPR. This is one of the biggest tools you'll use along with your transcript and the two additional handouts that were emailed to you, which is the pre-nursing flyer and then the educational plan handout itself. The degree progress report looks like this. Just note that anything in the green check mark means you've completed that requirement. Anything in the yellow diamond means it's currently in progress. And anything in the red box means you still need to complete it. Again, this is just to, remind you that this is going to be an important tool for you to use as you're creating your education plan. This, as far as your first step, and if you have your ed plan that was sent to you, emailed to you yesterday, please pull that up along with the pre-nursing flyer. If you don't have that by chance, I'll have Jacqueline or Amy in the chat box put the PDF in there so that you can open that. But what you'll do is you want to open all those documents up as we are going through this workshop. because in the first step, what you want to make sure you do is you check off the courses that you've already completed or that you have currently in progress. Now, you may have some of these courses completed already because you may have taken an AP test, or you've, did a college level class while you were in high school. The degree progress report will show you if you have, the requirements in progress or completed. So these are the 5 classes that you must have completed prior to applying to the nursing program. The first one is your statistics class. This is Math 124. This one is highly recommended from the nursing program. However, please note that ISED 160, Psych 171, DS 212, and AU 117, or as I mentioned, AP Stats, will fulfill also this statistics requirement. The second course is your microbiology with lab. This is biology 210 and 211. The third course is chemistry with a lab. This is chemistry 101 and 102. And then there's physiology with a lab, which is biology 212 and 213. And then human anatomy with a lab, which is biology 220. Or biology 328, which is the higher level anatomy class. Now, it's important for you to understand that there are prerequisite requirements that you have to have completed in certain in some of these certain courses. So there is a specific sequence that you want to be taking these classes. For example, you can't do physiology unless you've already done chemistry 101. And if you did biology 100 and 101 or biology 210. So there is a particular order you need to be taking these classes. You probably might be already enrolled currently right now with either microbiology or with chemistry, because these 2 courses are one of the very first ones that you will be doing prior to physiology and anatomy. I also want to point out that for pre-nursing students, your area, your GE area B2 will be automatically completed once you're done with your microbiology class and your physiology or your anatomy, which, as I mentioned, these are all classes you have to do as part of the nursing program. So don't take any other science classes besides the ones that you already have to do listed here. The other thing I'm going to point out is that these 5 classes, you need to have a C or better in them. If you receive a C-, the nursing program does not find that as an acceptable grade, so you will have to repeat it if you get a C- in any of these courses. So here is your ed plan. Again, this is the handout that was sent to you yesterday. What you want to do is not only use the degree progress report, but the pre-nursing flyer, the bulletin, assist, and your degree progress report transcripts in order to create this. I will be showing you how to use assist in a bit, but these are all the tools you'll use to create it. Now, as I mentioned, it's important for you to read the description of the courses because you want to make sure you have the prerequisites in order for you to be listing and taking them in the appropriate order. You'll see in your education plan that there's plan A, plan B, and plan C. And that's because in a perfect world, you can take everything in sequential order back to back, semester by after semester. However, as we know, that may not necessarily be available. You might not be able to take all the classes, the lab with the lecture as we want you to. So it's important for you to have your plan B and plan C in case you don't get into the science classes that you need to, since they are competitive to get into. This is an example. So as I mentioned, you may be taking microbiology, biology 210 and 211 right now for fall 20. So that's what this top is. FA stands for fall, SP for spring, SU for summer, and then this is the year. So in this Plan A, this student is doing microbiology 210 and 211, and they're doing it in the fall, along with their math 124. This is 2 of the 5 prerequisite classes they will have. Then in the spring, they would be doing chemistry 101 and 102, which is the lecture and lab. So this would be their 3rd prerequisite. In the summer, they're going to plan to take their biology 212 and 213. This is their 4th prerequisite. And then their last prerequisite, they're going to take the following fall again, fall 21, which would be their sophomore 1st semester. Now, this is the perfect world that if you were to get into all your classes, again, semester after semester, this is the perfect world. Now, what happens is sometimes classes fill up. And so that's where plan B here is. In this example, the student is again in microbiology lecture and lab, but for the spring, they didn't get into the chemistry class that they needed. So all they did is instead they weren't able to take any pre-nursing prereqs, but they went ahead and took remaining GE classes that they still need to complete. In the summer, then, they took chemistry 101 and 102. And then in the fall of their sophomore year, 1st semester, they took biology 212 and 213. And then their sophomore 2nd semester, that's what it's indicating here, is that they're doing their last prerequisite here. Same thing, plan C, because sometimes you get into the lecture, sometimes you only get into the lecture and not the lab. So in this case, the student was able to get only into the lecture of chemistry. They weren't able to get into the lab. It's definitely okay for you to do the lecture alone if you can't get into the lab, but you can never take the lab alone without the lecture. So in this case, the student did the lecture for the spring, and they are going to plan on doing the lab in the summer. And again, their 4th prereq in the fall, sophomore's 1st semester, and then their last prerequisite class, their sophomore 2nd semester in spring 22. Now, as you can see in all 3 different plans, the student is going to be taking summer school. This is something that's not required, but I highly recommend pre-nursing students do. That way, you can, apply at the earliest eligible time as possible, because as you know, you have to have these 5 classes done prior to being able to apply. And we'll talk more about, how you can take summer courses and where you can do that. I do want to note that SF State's anatomy class, which is biology 220, it may not be accepted at other nursing programs because our anatomy class is a virtual lab component. So if you are planning on applying to other nursing programs, which is something that we also, suggest you look into, you want to consult with their admissions department before you enroll into our anatomy class. And that's because their nursing program may not accept our virtual lab component. And so, as I mentioned, it's going to require you to do some research and contacting those other programs. And there is a possibility that you can, take, Bio 220 at a community college and be also still enrolled into SF State classes. So it's being you can be co-enrolled in classes if you need to. Because at the community colleges, anatomy with the labs are available. This is an example to show you that if you plan to take courses at the community college, you have to use ASSIST to look up the equivalent classes. What's also really important is that the community college classes, their descriptions and the prerequisites may be different from SF State's. And so it's important, again, for you to read the course description and make sure you have the prerequisites. Another thing is that sometimes, because the prerequisites may be different, you may be able to take your science classes in a different order at a community college versus like how it is at SF State. For example, at City College of San Francisco, the anatomy class doesn't require any prerequisites. So unlike ours, whereas I mentioned, in order for you to take anatomy, you have to have, either human biology or physiology done already. But at City College, you don't need to. So there is a possibility you can take anatomy out of, before or in a different sequence. Here's an example at City College. The microbiology equivalent is biology 120, and they have a prerequisites of chemistry 32 or 101, 108. Our microbiology doesn't have any prerequisites. You can take it, and it's typically one of the very first classes you do as a pre-nursing student at SF State. The chemistry equivalency is chemistry 101A or 103A or 32. And for them, and similar to ours, we have a prerequisite where you have to make sure that you are in the proper math placement. And then physiology requires you to have a chemistry class done. That's the same as our physiology. And then here's the anatomy, as I mentioned. There is no prerequisite at City College, whereas at SF State, it requires you to have physio and chemistry done. So again, what's important is for you to read the description of the course so that you understand that you meet the prerequisites with them. This is the ASSIST website that you want to use. And you want to make sure that the academic school year is always the most current one. And then the institution listed here, you want to make sure it's the City College that you'll be attending. And then this third box, you want to always make sure that it says San Francisco State University. When you press view agreements, it will give you a whole list. It will list to you, I'm sorry. It will list to you how that works. Let me actually demonstrate that into a new screen for you just so that you have. 1 second. So, here is ASSIST. So this is the website. And here's the most current academic school year. Let's say you want to go to City College. So you'll find City College of San Francisco. Click San Francisco State University and view agreements. Let's say you wanted to take a biology class. So you're going to switch this to department. Go and find biology. And when you click view agreement, this will list to you all the classes at San Francisco State University, and then the equivalency class at City College on this column. So here's an example, biology 212 and 213, the equivalency at City College is bio 111 or bio 112. So this is how you'll want to make sure when you're registering for classes at City College, you're registering for the correct equivalency class.
You know what? They can't see your other screen. It's still on your PowerPoint. Can you do that demo one more time, please?
Sorry about that. Let me. So here is the demonstration again. Sorry, here is the most up-to-date academic school year. Here is, let's say you want to go to City College. So you find City College here. And then this one, you want to always make sure it says San Francisco State University because you want City College to have an agreement with SF State. When you press view agreements, you'll be prompted here. Do you want to look for the agreement by major or by department? You can do by major. If you know it's department, like you want to find a biology class that's equivalency, you can go by department and press view agreement. And then you will see on the left-hand side, all the San Francisco State University classes and the equivalency class listed on the right-hand side from City College. So again, Bio 212 and 213, the lecture and lab is equivalent to City College's Biology 111 or Biology 112. And as a reminder, at the community colleges, the lecture and the lab are already built in. So Bio 111 has the lab already component built in together. Same thing with Bio 212 versus at SF State, you have to sign up for the lecture and lab separately. So that's how you will use ASSIST if you want to make sure, if you want to take classes at the junior city college in your hometown, which is something I highly recommend you do. And again, in the summertime is probably going to be one of the best times for you to consider doing that. And then this is to just remind you about reading the prerequisites and then reading how the description of the course. So you'll always see the description of the class and then the prerequisite listed here. Now, your step 4, as far as completing your education plan, is to figure out when you would be eligible to apply, right? So you're eligible to apply when you have your 5 classes completed. Note that you have to have both the lecture and lab of the science classes to be completed. Both need to be completed in order for that to be counted as one full prereq being completed. So if you're missing the physiology lab and you've already done the lecture, it's not going to be fully counted as you completing it. They can't be separated, the labs. So if you're missing physiology lab 212, biology 212, 213, and anatomy 220, that's 2 different requirements that you're missing. And all the classes need to be completed at the time of your application. So there are 2 different application timelines. You can apply in the fall admissions, which is always between October 15th and January 15th, or you can apply for spring admission, which is always between August 23rd and September 17th. You decide which application period works best for you, as long as you have all the admissions and requirements and all the prerequisite classes completed, and you can apply for both admission periods. You will use this nursingcast.org website to apply and submit your nursing application. This is similar to kind of like how Cal State Apply is. It's kind of like the big hub of where all the nursing applications are. This is an example of when a student, helping you figure out when you would be eligible to apply. So for student A, they got microbiome and the math. That's 2 prerequisites in the fall. Their third prerequisite in the spring. Summer is their 4th prerequisite, and then their final prereq is bio 220 in the following fall. So if their last prereq class is done in the fall of 21, they would be eligible to apply for the following fall admission cycle. And so they would apply between October 15th, 2021 and January 15th, 2022 for the fall 22 admission cycle, because that will be done. Now, student B, here's 2 prerequisites, microbiome, the math. They weren't able to get any of the prerequisites done in the spring. They were able to get it done, chemistry, their 3rd prerequisite in the summer, their 4th prereq in the following fall, and then the following spring, their last prereq. Done. So because this student will have their last prereq done in spring of 21, they would be eligible to apply for the following spring admission cycle. They would be applying between August 23rd and September 17th of fall of 2022 for the spring of 2023. Student C here is similar. You'll see that they have the 2 prereqs here in fall 20. Here's the third, right? Because chemistry 101 and 102 were separated. They were able to do the lecture and lab together. They will have their 3rd prereq done summer of 2021, the 4th prerequisite done fall 21, and then their 5th prerequisite, again, spring 22. So student C would be applying during the same period as student B, because their final last prerequisite class isn't done until spring 22. Again, they would be applying for the spring 23 admission cycle. What you want to do is you want to make sure in your ed plan you have all the 5 prereqs listed in the semesters that you plan to take them in order for you to figure out which admission cycle you would be eligible to apply to. Now, it's not only, and so what you want to do is you want to make sure that you're listing that in your step number 4 of when you will be applying and then when you would be starting the nursing program. The other things that you need to consider as far as your admission is that you have to take this ATI TEAS exam. This exam is kind of like, it's a standardized exam, similar to like the ACT, SAT exam. It measures your reading, writing, math, science, including anatomy, physiology. It measures or your success as a future nurse, and then by taking the test in those test subjects. Note that you have to have a 78% or higher within 3 attempts. At SF State, we allow 3 attempts. At other programs, they may not. So again, that's where you will want to make sure you do some research. Now, 78% is the minimum score that you must have in order to be able to apply to the nursing program. But I want to note that, you know, the higher the better. For example, last spring, the students who were admitted, the average score of the admitted students from last spring was at 89.9%. So that's a lot higher than the minimum required for you to have in order to apply. Similarly, the 5 prereq classes that I talked about, your science class and your math class, you minimally need to have a 3.0 or higher in order to be eligible to apply. Again, the higher the better, because the students, the average score or average GPA that the spring students had who were admitted last spring, their GPA was a 3.89. So again, it's a lot higher than the minimum required. So the higher the better, but minimum you have to have a 3.0 GPA and a 78% on the TEAS exam. There are other admission criteria that is not required. It's supplemental. And so the nursing program does highly recommend you have either health-related volunteer or work experience and also service to underserved community volunteer experience. Though it's not required, if you have 120 hours or more, you could get points on your nursing application. If you're also multilingual and you're using those additional languages within your healthcare experiences, as well as your underserved community experiences, that could help give you points on your application as well. And if you're a veteran or active duty military status, that could give you points on your application. Now, the health-related experience, this could be indirect or direct kind of experience. Direct experience is essentially if you have your CNA or EMT and you're directly working with patients, that would count as direct work experience. Now, there's indirect healthcare related experience, and that's if maybe you are greeting, patients, or you are helping, push patients to their rooms, or, you're having some sort of interaction in a clinical hospital setting with patients, but not necessarily doing like work that you're not certified to do, like draw blood or whatnot. So that's healthcare related experiences. And then service to underserved community volunteer experiences. This is really anything that you are doing to help build your community. So you might be volunteering your time with the, Boys and Girls Club and, working with their after school program, or you might be, volunteering your time and, at a food shelter. So several different experiences count as far as service to underserved communities. Now we get a lot of questions about, well, is there a list of places that I should volunteer, or recommendations from us? And because we have students from all over attending SF State, we don't have like a list, a standing list or anything. Our nursing student association is working on building a list, but that's not yet available. And when it is, we would definitely be emailing that to you. But I recommend students really just do some research within your own community. Look at your hospitals, clinics, nursing homes, and call them and just ask them, are there any volunteer experiences or opportunities for you to do? I know that we are in very strange times given COVID, so there might be a lot of limitations right now. But you have time, maybe hopefully by spring, summer, our our situation is different in that you'll get some opportunities to get those type of experiences in. And again, this isn't necessarily required. It's recommended for you to get some sort of experience so that you understand what it takes to become a nurse, or have a sense of what that kind of environment looks like. But it is not required for you to have completed for the nursing program application. And then we will always talk about this, is for you to have an alternative plan. So whether that's looking at other nursing programs, or looking at other majors, but we highly encourage you to look at alternative plans. If you are interested and consider applying to other programs, you need to do that research as far as the admissions requirements on your own. And there are advisors that we will definitely help you review, but it's going to be a good start for you to start looking at that. There are a lot of other programs that require other classes, such as Psychology 200, Nutrition 253, or Sociology 105. They also might have different entrance exams. So instead of the TEAS exam, they might have the HESI exam instead. And as I mentioned previously, they might allow you different number of attempts as far as taking the test that they require. So it's important for you to do this research now, so that you don't disqualify yourself from other programs that you might be interested in applying for, or that you add those other classes that you need to take for other programs into your education plan. Again, you want to maybe consider other alternative pathways to the nursing or other health professions. We have our Pathways to Nursing and Other Health Professions workshop coming up in the spring. You'll get an email invitation, like how you did for this workshop, to attend it. It's definitely going to be a really good opportunity for you to participate in, so that it can help you start thinking about how can I still become a nurse, or what other professions, health related, can I get into. Our nursing, our Student Resource Center website has other pre-nursing events and workshops. You also get them in your email. So make sure you are consistently checking your email to make sure that you're taking advantage of these opportunities in order to set yourself up for the most success possible. This is our contact information. Feel free to take a picture of the screen. You can email us. Right now, we are all working remotely, so email is probably the best way to contact us. And then again, our student resource website listing the different workshops available. That concludes the workshop, and I'm going to change my screen so that way I can address questions, because we have about 15 minutes left of this workshop. And so I want to make sure that I'm addressing any questions you might have, that we weren't able to do that in the chat box currently. Let me see. That's okay. Yes.
Yeah, Pokua, I think all the chat questions were answered. Amy, you can let me know if you saw one in there, but I think those were all answered.
Perfect. If there are any questions now, feel free to add them in the chat box. Yeah, if those are, yeah. Otherwise, if you don't have any questions, feel free to leave. I will remain in the Zoom so that I can address any other questions other students might have. So how many units do we need for prereqs? So there's not necessarily units that you need. There are 5 classes that you need to complete as far as the 5 prerequisite classes, and they need to be completed by the time you apply to the program. As far as making appointments with your major, so the nursing department does not meet with students, pre-nursing students until you actually officially get in. But as a first-time freshman student, you are assigned either myself as your advisor. And I've sent emails about how you can make an appointment with me. If I'm not your advisor, there are definitely your advisor has been also contacting you, because each of you have been assigned a particular academic counselor who can help you talk about pre-nursing classes, and even to help you, review the education plan that you create today to make sure that it looks correctly. But definitely check your email for the links and contact information about how to make an appointment with your specific counselor. Do you recommend taking Bio 211, Chem 101, and Chem 102 in the same semester? So sometimes what happens is, in order for you to continue in the sequence, sometimes you don't get the lab, as I mentioned, so you might be taking 2 labs and 1 lecture at the same time. That does happen frequently. As far as recommendation, I would say, as I mentioned, it happens. I would say it would be important for you to kind of think about yourself and feel like, is that gonna be enough or too much as far as science classes? But that is a common situation that does happen, where students might be finishing up the lab from the lecture from a different semester, and then to remain on track with their application period, they continue on with the next sequence of science classes. Yes, so it would say monitor how you feel as far as the number of science classes you take in 1 semester. Other questions? So I think that it would be important, that you follow up with your academic counselor that's been assigned to you in order to review the ed plan that you create today, to make sure that, again, all the prereq classes that you need are in correct order and correct sequence, and they can help double check that the application period you listed or have is most appropriate. And also, just to talk more about the TEAS exam, we do recommend you study in advance. So depending on when you take or when you plan to take it, we say you should probably study about 2 to 3 months in advance, because it is an important exam that you want to do well in. And ATI testing is the website that you can use. Let me find the website so that I can put that in the chat box. Oops, what did I do? Hello? So ATI testing is the website that you can definitely start exploring. They have study prep materials. You can register and make an account. That's how you are going to also register to take the test. Note that you should not be taking the test anytime soon. The reason being is, as I mentioned, the test is going to have some anatomy and physiology on them. And so you want to make sure that you take as many of your science classes and complete it before you take the test. So that way you have that knowledge to be able to apply to and use when you're taking the test. So, you know, depending on when you're applying is when I would say work backwards of when you should be planning on when you should take the test. And then even again, when you take the, depending on what date or month you take the test, you should be taking at least a month or two ahead to be studying for it. There is also this website that I'm putting in the chat box. This is the website that I would highly recommend you use to look up other nursing programs that you might be interested in applying to. The website essentially gives you direct links to that institution's nursing website where you can easily access what are the admissions requirements and what are the classes and prereqs that you might need to complete within that particular nursing program. Other questions? So do most of the admitted students apply with healthcare related experience? Yes. So yes, about 80 to 100% of the students who get admitted to the nursing program have some sort of healthcare related experience. Yes. And the nursing program highly recommends it because they have mentioned that in the past, those students who have not had that experience, once they get into their first semester and you go right into your like practicum classes, which is clinicals, they've seen a lot of students, you know, end up dropping out their first semester because that was their first experience in a hospital setting and it was something they were not expecting. So to avoid that, they highly recommend you get some experience now so that you understand what kind of environment you would be working in as a future nurse. And it would count if you volunteered at a hospital during high school, yes. So I should note that any experiences that you volunteer for, you want to make sure that you get a letter of verification completed by them on their letterhead. And let me share my screen because there is on the nursing website an example of the template you can use or ask your agency that you volunteer for to use in order to document and verify that you have completed so many hours during, you know, the certain amount of time frame. So let me find it because they just changed their website. So here you'll see the health-related work letter template, and you'll see here the service to underserved community templates. And what's important is, again, it has to be on their letterhead. Make sure that your full name is there, the name of the organization, start date, end date, hours per week. And then what's really important is that your duties and responsibilities are being explained in this letter. And then you want to keep these letters because eventually these are the letters that you're going to need to upload and put into your nursing application. So I just put the link to the nursing website on there that lists the templates. Would it count if it was an internship? Is that different? No, an internship is still experience, and so it would definitely still count, Julia. You'll just want to make sure again that you get your verification letter completed. Yeah, and as Amy mentioned, you know, the more experiences, the more competitive you are. And, you know, it just, I think if anything, it just also is a really valuable experience. It's gonna be a, long journey as far as completing prereqs and admission requirements for the nursing program. So by you getting the experience, that's going to help reinforce, you know, your desire to become a nurse, and, you know, to help you motivate and encourage you to, you know, be the most competitive candidate possible. So I definitely think it's a valuable experience for anybody, just so that you know what, you know, it could be like as a future nurse. Yes. Eventually, once you, you know, there is, you know, an interview process as far as the nursing admission process goes, where, you know, if you get through the first round, you'll get invited to an interview process. And as Amy mentioned, these volunteer experiences is going to be an opportunity for you to share with them as you are at the interview with the nursing program. And yeah, they definitely, you know, you can definitely share your experiences and what you've learned through those healthcare related volunteer work experiences. And Amy put in the chat box the timeline as far as admissions periods. And I want to just, you know, reinforce the importance of having your parallel plan or your backup plan early on. That way, when it comes to applying to the nursing program, if you know what your parallel plan is, whether that's a different nursing program, you're applying to those other nursing programs, or if it's another major that, you know, you want to apply to at that point, you understand what their requirements are. So if worst case scenario, you don't get into the nursing program, you're going to be able to continue seamlessly into that backup parallel plan. All right, we have a few minutes left. Let me show you. Let me show you our website, the Student Resource Center website, where you can find the other. Other workshops that are coming up. So if you go under current students, the College of Health and Social Sciences, which is where all of your pre-nursing designation majors are hosted under. If you go to for students and you go to view SRC, Student Resource Center, when you go to workshops listed here, you will find all our workshops. So you may have also gotten an invitation to the Fall 2020 Tips, Advice, and How-To Pre-Nursing Workshop. This is a workshop that you'll be hearing from directly current SF State nursing students. So if you want to learn more about volunteer opportunities, more about the nursing CAS application, this might be an opportunity you might be interested in, you know, attending. This is December 2nd coming up. And this is from last semester. Actually, this is from spring last semester. This is our Nursing Student Association. We had a Q&A kind of panel. So just more resources for you to be aware of and to utilize as you're planning and creating your education plan for the upcoming semesters for the nursing program. We have a minute left, so if there's any lasting pressing questions, feel free to ask them. Otherwise, as I mentioned, you're definitely free to go. And I definitely, as I mentioned, want you to follow up with your academic counselor And make sure if you're interested in other nursing workshops, you definitely can look on this website, which I'll put the link into the chat box for other workshops. The workshops are also emailed to you, so check your SF State email because it gives you direct links to each individual workshop and how you can sign up for them. But I want to thank all of you for attending today's workshop, and we look forward to seeing you one-on-one. Otherwise, take care and be well. Thank you. Bye-bye.